So a couple of things. So when you're setting up for amalgam, you're going to have your tray set up. It's not always going to be in order for you or intentionally going to mess it up so that you can practice putting it in the right order, because that's part of what you'd be responsible for knowing. And then the other things that you need, most of them are going to be in this like third drawer here. It says right on it, amalgam supplies, tells you 3, meaning it should be in room 3, and tells you the contents of this bin. So this should be what you need to get out in addition to your instruments, okay? So in here is the actual amalgam. So you should have one of the amalgam capsules on your tray, okay? Some of them need to be activated first. So for example, this type, you can see that it has that opening here, so you have to push that to activate it before you put it in the amalgamator. This type does not have to be, okay? I believe you started to talk about amalgam and dental materials, so you may or may not know that there are 1, 2, or 3 spill amalgam capsules, depending on how big of a restoration you're restoring. So if you were just doing an occlusal, you'd probably use a 1 spill. If you're doing a 2 surface, you use a 2. You're doing a 3 surface, you're going to use a 3. And sometimes if you need more, you would just use a second capsule, okay? In here also you have your bender brushes. So you will need one of those on your accessory tray. So that bender brush is going to be for your varnish, which is called copalite. So you can draw in a little circle.
Sorry, what was the brush called?
Draw in a little circle and write copalite, C-O-P-A-L-I-T-E, copalite, L-I-T-E, and write copalite, and then you can draw in a little line, and that's for the brush for the copalite. It's called the little micro brush. Inside this amalgam supplies, you'll have your wooden wedges. So depending on what type of restoration you're doing, you're going to need either 1 or 2 wedges. So if you're doing an MO or a DO, you would need just 1 wedge. And if you were doing an MOD, you would need 2 wedges, okay? So remember that you put a wedge on whichever wall is missing, okay? You're going to need articulating paper.
And this is all in the accessory tray?
No, this will end up going on your regular tray, but it's in here. So your articulating paper is what's going to mark on the teeth so we can check the bite. There are a couple different ways that this comes. It comes in these little packets like this. Okay, so obviously the paper in between is just to keep those separate. You rip off a piece. And you can see it's quite long, so you wouldn't want to do that and pass that off to the doctor, because you're going to choke and gag the patient. You don't need all that excess, okay? So you can pretty much rip that in half and put it in. Now, a couple of things when you're loading the articulating paper onto the forceps. One, you want to make sure it's going the right way. So this is the handle. The patient's going to bite down here, okay? So you want to make sure that you don't have it going this way, because then the patient would be biting on the handle, okay? So if I think of it, that looks like a flag. Okay, so this is the handle, this is where the patient's going to bite, okay? The other thing is, if you have the type like this that you're going to need to tear, this is only my personal pet peeve, you won't find it in the book, but you don't want that jagged edge at the top. You'd rather have that jagged edge at the bottom, so it's nice and neat and even there, okay? Articulating paper can also come in this little nifty holder. The nice thing about this type is that you can pull it and rip it to whatever length you want, okay? And you can see it has that protective, what's that called? Like that paper, like carbon, right? Isn't it called like a carbon something? On either side, okay? That's your articulating paper. In here is also a squeeze cloth. This is for the amalgam once it's mixed. In the olden days, we used to dispense the amalgam onto this, roll it up, and then squeeze it to wring it out. Obviously, that's not recommended anymore. We try to minimize the handling of amalgam, but this could still be used to dispense your amalgam to pick it up, and then this would obviously single-use discarded after use, okay? The alternative to that, and there's also some extra burrs in there as well. The alternative to the cloth is the amalgam well, okay, that the amalgam, once it's mixed, is placed in there, and then we're able to pick it up and scoop it from the amalgam well, okay? You're going to need to set up your matrix band before you get going, so you're gonna have to decide which tooth number you're working on, and we do a 19 again. So for the performance exam, you are responsible for setting up the band, but the operator will place it. So you don't need to place it, but you'll be responsible for setting it up. So you'll need to ask which tooth you're working on and set up your band. Remember, there are only two options, well, I guess it's three. You can set it up universal for maxillary left or maxillary right, and maxillary right's gonna also work for what? Mandibular left, correct, good job. Which knob adjusts my circumference? Right, the inner knob. So the inner knob is going to adjust our circumference to make it bigger or smaller. The outer knob is going to drive that spindle pin and hold it in the matrix, the top and mire all together. Okay? So I'm going to double check and make sure that's right. So that's set up for the lower left. Okay? I have my cotton rolls for isolation. I have my floss. I have my 2x2s. I have a needle holder, so you might want to write that in next to the syringe as a recapping device. My anesthetic. And I said my wedges. So you can draw in a circle and write your cup for trash. So another circle, that's your cup for trash. And then I'm going to dispense something called die-cal. So I don't think you started talking about this in the materials yet. You can draw a little square, and then write die-cal in the middle of the square. Di-cal is a calcium hydroxide. It's a catalyst and a base. So before you start working, before you get contaminated, you're going to want to dispense that. You just do about a drop of each. And you want to make sure that they're not touching, because once they touch, that chemical reaction is going to start. So I'm going to have 1 drop of catalyst, 1 drop of base, not touching each other, equal amounts. And I'm going to take those off of that tray so that they don't get contaminated. A copolite is going to get contaminated, unfortunately, so you're going to need to disinfect that after. Okay? Before you get started with the procedure, you're going to want to load your amalgam. That's why it's ready to go. So if you have the type that needs to be activated, you're going to just push all the way down. Your amalgamator should be covered with a barrier over the start button and over the window or door that you're going to lift up, so that we don't contaminate those, so they're barriered. So the calcium hydroxide we're going to put down, you'll see we're working in the deepest part of the prep. That calcium hydroxide is going to help to stimulate secondary or reparative dentin. So picture little men with hard hats down there working to get more dentin there. Remember that we go enamel, dentin, then pulp. So you want to keep that filling material as far away from the pulp as we can. The closer it gets to the pulp, the more likely the patient is to have post-operative sensitivity, okay? So that's going to help to add some bulk. So that's always going to go in the deepest part of your prep, okay? The copolite is a varnish, and that's a sealer, okay? It has a very caustic odor. You can probably waft it even if you're not too close. So that you open it, you dispense it onto the applicator, and then you close it right away, because you don't wanna leave that open to be inhaled, okay? That is a varnish, it seals all the dentinal tubules, so when we go in and we use the handpiece and the hand cutting instruments, and we cut into the tooth, we're gonna open up all those dentinal tubules, which can lead to post-operative sensitivity. So that varnish is gonna seal those, so it seals off those tubules to help to kind of soothe them and seal all the medicaments, like the Dical, whatever we use, it's gonna help to seal that all into the tooth. It also helps to prevent micro leakage, right? So I know you started talking about that around restoration, so it'll help with micro leakage. Dical, calcium hydroxide, can be used with any restorative material. Copalite cannot be used with composite. Okay, so we'd use it with amalgam. And it can be used with glass ionomers, which I don't think we talked about yet. All right. Any questions before we get started? Okay. Okay, we're ready. So we always start every procedure with the mirror and explorer. So when you set your tray up, you're gonna set it up mirror, explorer, and then you're gonna flip those. Remember that this pass-off is when you'll get graded on your instrument transfers, because you haven't had a pass-off on that yet also. And then we're gonna get ready to dry the area for the topical. So you're gonna fold your 2x2 in half, fold it in half again, and then clip it on your cotton forceps. You don't wanna clip it this way so that you have these open ends going into the mouth. You wanna put it on that end, that way you have this closed end going into the mouth to dry, okay? I have my cup for trash. A local anesthetic, remember you're gonna pass underneath the patient's chin. I'm going to pull the cap off. I'm gonna hold on to that with my fingers and open the rest of my hand, and she'll come right out. And then I'm gonna put that in the recapping device, because we never accept the non-cap needle back. I'm then going to get the saliva ejector. Sorry. And we're gonna place that on the opposite side of the mouth and where we are working, so that's gonna go on the right. So I'm gonna give that a little curve, a little fish hook, turn it on, and we're gonna rest that in there for the patient. Okay? So as soon as she picks up the high-speed handpiece, oh, and the bird, you wanna talk to them about the bird?
So we talked about burrs on the high speed, always making sure that it's pointing away from us, right? Because it is a sharp, so we would never want to cut anybody or ourselves, so it's always pointing away.
And the burr should be loaded before you start, so it's all set for the operator. Now, I'm going to have the HVE, okay? And then I'm going to have the air water syringe. Now, we don't have that in the paper because it's not technically required at this point for the pass-off. But in the real world, you would often have the air water syringe also, so that if their mirror gets cloudy, we can clear it. It's particularly a concern when you're working on the maxilla, which is the air water syringe in my left hand, just in case we need it or if we need to rinse, okay? So remember now all your principles of moisture control, so I wanna make sure my bevel's parallel to the tooth that we're working on, slightly occlusal and slightly distal. Now when she's done, I can go right in and rinse. And then I'm gonna grab the Explorer so that she can check and see if we're down to the decay. Remember to always direct your instruments down to the arch that you're working on.
Good, we are down to the decay.
We're down to the decay. So now she's going to use the spoon excavator to start to scoop that out. I'm going to, so I just walked back, I'm going to keep the Explorer in my left hand, and with my right hand right to the mouth, I have a 2x2 so that I can clean any debris from that instrument. She's going to check again with the Explorer. I'm going to clean the instrument, and I have it ready. Do you need this? So she needs this back, there's more decay. She's gonna check again.
All set.
All set. So we've gotten rid of all that decay, so I know we're ready to move on. So now we're gonna start with that cavity preparation. These instruments, the mesial, distal, chisel, hatchet, not all doctors are gonna have those on as part of their setup. They might do that all with the high-speed handpiece or slow-speed handpiece with burrs, okay? So this is hand cutting. They might do it with a rotary instrument rather than hand, okay? So if they don't have them, as in the video that you saw in Simpic, they didn't have them, your life's just a little bit easier. A few less instruments you have to pass, okay? For learning purposes here, I think it's good to use them because it's easier to make sense of what they do when you're physically using them, okay? So I'm gonna pass off that mesial margin from her first. I know this is a mesial because it has the point closest to the handle, closest to the midline. Everything I'm taking back, I'm putting back right where I got it so that if I need it again, I know exactly where it is. This is the distal because my point's going further away. Chisel. And then hatchet. I know this is a hatchet because the points are even. There is no point there, okay? So we are removing any undermined, dented, or enamel, planing, and pleating the walls of that preparation. And now I'm going to give her the Explorer to check. She's going to check her prep.
And we're good.
And good, so the prep is completed. So now you look, we're going to move on to banding and isolation. So I'm going to rinse and dry because now we would have all those pieces of undermined enamel, pieces of dentin, pieces of tooth, maybe some decay, fragments of decay still lingering in there. So we're going to clean this so that before we isolate, we know we have a nice clean prep. So I'm going to rinse and dry. When you dry, you want to do what we call, I'm going to do what we call a white dry, okay? That's going right on. This is a white dry, okay? The reason why we white dry is once all those dentinal tubules are open and you go in and blast air, you can over dry or desiccate them and cause permanent damage, which will lead to post-operative sensitivity, okay? So I know I kind of just, anytime I'm drying, I always do that. I'm just kind of in the habit of always doing a white dry and not giving a straight blast, okay? So now I'm going to pass the matrix band off. I want to pass it to her just like it's going to go into the mouth. I'm going to get my wedges in the palm of my hand. We're doing an MOD, so we need 2 wedges. And I'm going to get my cotton pliers. And I apologize that I'm not sitting ergonomically correct because the knee's not so comfortable up today. You should always be waiting with your next instrument so that we're waiting for them, they're not waiting for us.
Oops, sorry, my bad.
Okay. This makes me miss being GSI. Okay, the next thing we're going to pass off is the condenser. We're going to pass our condenser because these come in many different shapes and sizes. Most of them have a small end and a larger end. So we wanna make sure that the size that we've selected is gonna be appropriate for the prep, make sure it's gonna fit in the prep. So I'm gonna pass that to her so she can check and make sure it's gonna work.
So can you just explain the rinse and dry optional?
After the cavity prep?
Like anywhere it just says rinse and dry optional.
Yep, so that would be anytime you need to clean the area.
Okay.
So if there, like I said here, after the cavity prep, you would most likely want to rinse and dry because you're going to have pieces of enamel, pieces of dent, and like fragments of, you know, the cavity, fragments of tooth, all of that stuff in that prep still. So you want to rinse and dry it before you fill it to make sure it's nice and clean.
Okay.
Okay?
Thank you.
So then once you did the condenser, if you wanted to rinse and dry again, if it got dirty at any point, if it still looked like there were fragments in there, you would rinse and dry, okay? Now she tried her condenser, she's all set with that. So now we're going to place our cotton rolls. So we're gonna put one on the lingual and one on the buckle. And then I'm gonna get ready to mix the dye count, okay? Again, everything is going back where it belongs, that way I know where it is, or if she needs to grab something, she knows where it is on the tray. So now I'm going to bring my dye cal over, and I'm going to mix it with the dye cal instrument. You're gonna mix these just until they're homogeneous, meaning that they're uniform or it's the same. Okay, so it ends up being like a off-white color. I'm gonna get the bulk of the material off my instrument. I'm going to wipe my instrument with a 2x2, and then I'm going to pass her the dye cal instrument. In my left hand, on the pads of my fingers, I have the pad so she can grab what she needs, and with my right hand, I have a 2x2 ready to clean that off for her. You can see I want to be nice and close to the mouth with everything that I'm doing, because remember, she might have those loops on that she can only see a very tiny area. I can go right in my trash and in my trash, okay? Now we're gonna go right to our copalite. The copalite I'm gonna open, I'm gonna dispense, and get that cover back on as quickly as I can. You guys are gonna smell it, it's potent. And then as soon as I pass that off, I'm gonna mix my amalgam, so you can see why I wanted to have it in there already, okay? So that's mixing.
And is that on an automatic timer, or does it?
Yep, so you set that per manufacturer's instructions, depending on what type of amalgam you're working on, so I already have all that preset. And now I'm gonna open up my capsule and drop my amalgam in there. You wanna make sure you dispense the amalgam and then close it up right away, and that goes into your cup, okay? I'm going to fill both ends of my amalgam carrier. And I need to talk about the amalgam after. I'm gonna fill both ends of my carrier, and I'm gonna pass off the small end first. They'll usually let you know which end they want first. If you pass the small end of the carrier first, then you'd pass the small end of the condenser first, always angled towards the arch we're working on. When I get this condenser back, I'm gonna squeeze it, make sure I get rid of any amalgam that was in there. There's no flash like hanging around the sides. And I'm quickly gonna work to fill this up. Now you wanna work pretty efficiently at this point, because this will start to set up on us. So as soon as I get it back, I'm quickly gonna work on pushing against the sides here to help fill that up. And then she'll usually let you know, but I'm gonna tell her I have both ends filled there. And I'm wiping off the condenser as I get that back. And we're gonna go back and forth with the carrier and the condenser until our prep is full, okay? So she tells me she has enough. Sometimes you might need to mix a second capsule if needed.
I have a quick question. Before you turn on the amalgam, you have to do let the station know, or do you just go ahead?
No, I usually just turn it on, yeah.
Good question.
Good question. So this is the last of the amalgam. So she'll let me know if she needs more.
We're good.
Good. I'm gonna make sure, I know I'm not giving this back, so I definitely wanna make sure that this is cleaned out. Because if this goes into steri, it's gonna set, and then it could end up getting autoclaved with the amalgam in, and it's gonna release the vapors. And unfortunately, it's happened even here, and then we're using the high-speed hand piece to drill it out. So that's no brainer, we go with that. So we're gonna repeat it until full, and then you're gonna go with a large ball burnisher. And then I'm gonna get her the discoid keloid, and I'm gonna grab my HBE because she might have some fragments. As she started to carve. So that discoid keloid, she's gonna start to carve some of the anatomy on that occlusal portion. So as an expanded function in the state of Massachusetts, dental assistants can place, pack, and carve amalgam. So technically the dentist can just do the anesthesia and the prep, and then the assistant at the FDA could finish the rest. So now I gave her the Explorer. With that Explorer, she went around, like if you filled up a pail of sand, she went around and broke that seal so that we can get ready to remove that matrix skin. So I'm going to pass her the faucet, right? Yeah. The pliers to remove the wedges.
It's
And then-
like college pliers.
Yeah.
Yeah, that's
Cotton
another.
pliers, college pliers, the same thing, yeah.
Okay.
Yep. And I have my hand here to receive the wedges. And then she's going to remove the matrix band, the Toppelmeier. So I'm going to take that and give her that back to seize off the band. And I'm going to put that right in the trash.
Isn't that like a little sharp?
Yes, you deal with that after. Yep. And then now we are going to do the interproximal carver because we just got that band off. Saliva ejector. So we're gonna turn the saliva ejector off and then take it out. I think technically the off one.
Yes.
Oh.
You have to wet the cotton roll.
We're gonna wet and remove. We're gonna wet and remove the cotton rolls, and then the operator is going to turn that saliva ejector off and take it out. Why do we turn it off first?
So it doesn't spit the stuff out.
So what?
So it doesn't have like what the stuff into it doesn't come out.
Right, so the floor of the mouth has really soft tissue and it's very thin, so it can suck up into the saliva ejector, and then if you just try to take it out, it can pull. So now we just took the band off, the wedges, all the isolation, the cotton rolls. So we want to address the interproximal of that restoration while it's still soft. And I'm going to get my HVE. And then I'm gonna get ready to pass her off the articulating forceps just as we're gonna need them. And I'm gonna grab my discoid cleoid because if that restoration is high, so the articulating paper is gonna check the bite. So it's gonna mark anywhere that the patient's hitting too heavy. So then she's gonna go in and adjust those areas, and that's gonna definitely create some dust from the amalgam, so I'm ready to get that. And then she's gonna need to check again, so I'm gonna keep the articulating paper here. Passing it off, she's gonna check again. She's gonna let me know
We're good.
all set, so I can put the discoid cleoid back. Take that back, and we're gonna go to the beaver tail, or the acorn burnisher. And then I'm gonna get my T-ball burnisher ready. And then I'm gonna get the floss. I'm gonna shut that off. Get the floss, and I'll show you a little trick with the floss in a second. So we're gonna pass off that floss. And And I'm gonna get ready to pass that Mirror and Explorer because we always start and finish with the Mirror and Explorer, so make sure you flip those so they end up in the right hand.
Beautiful.
Okay, and we'll take that, and then sit. Okay, now, when you're setting up the floss, you wanna get the floss, this one's obviously been used a little bit, so it's a little beaten and battered, but you're going to take the floss, put it, have a little tail, a little bit sticking out, and you're gonna use your index finger and your middle finger, and you're gonna gently wrap it around. You're gonna slide it off your fingers, pinch it right in the middle. It's wax floss, so it'll stay. So it makes almost like a little bow, so that when you put it on your tray, it isn't all over the place. So what will sometimes happen is if it's just strewn all over the tray and you go to pick something else up, it falls off your tray. So now you just lost your floss, it's on the floor. So this keeps it neat and out of the way, and then when you're ready to use it, you just have to pull on the ends, and then you can pass it right off to them. And you go to clinical and do that, and they'll be so impressed. Okay. All right. Questions so far, and then I'm going to show you what you do with the tray. No? Okay. So now we need to deal with the tray. Okay. So the first thing we'll do, you have to take the burrs off because that's going to need to be sterilized. We would take the handpiece off. That's going to need to be sterilized. Any excess amalgam on the tray, we're going to suction up. Because where's this amalgam going to go? So what I'm suctioning up? Just into the trap, right? So it would get caught. Anything small is going to go, and it's going to go into our trap that is within the condenser. Okay, there's a vacuum, there's an amalgam filter type thing in there. Otherwise, it'll get caught in the trap if there's a larger piece. Anything left in your amalgam well, that time we used all of our amalgam. These jars are kept down in the bottom drawer, okay? Each unit has them and they're labeled with the treatment room number, so they should stay within each room. This one tells you it's contact amalgam waste for recycling wells, so this means it contacted the patient. So anything that's left in here goes in here, and then you just suction up the little fragments that are left, like I did with the HVE, okay? In your trash now, you have your capsule, the capsule, that's going to go in here. This says non-contact amalgam, okay? And then my band is going to go where? In the sharps container. So I'm gonna get rid of sharps, right? You remove sharps chair size. And then I'm also going to get rid of, right, when you take the recapping device off, you wanna make sure you hold on to it, because if I just pull this, it's going to pull the cap off the needle. So remember, you hold it by the hub where I know the needle's not potentially gonna stick out. You see how all your labs are coming together now? Isn't it fun? You can feel like a real live dental assistant. You're like, wait, look at all this stuff I can do, right? So that comes off. Where's the carpule go?
Technically supposed to go in there, but
So as long as it's not cracked or broken, it can go right in that chair sideways. If it's cracked or broken, it's gonna go in there, okay? So then we'll get rid of all of our disposables. So those can go right in the trash now because we have nothing sharp in there. This would need to get disinfected because we touched it, right? This is all gonna get autoclaved. Okay, so this would get disinfected, this is gonna get disinfected, this is gonna get disinfected. That would all, your tray cover, your V-lock tray cover would go on, and you transport to steri.
and you're keeping exam gloves on while you're like breaking
Well,
down.
I was doing that, yes. Yep. And then once I start getting ready to transport, you're gonna put your utility gloves on to come back, well, to deal with your instruments and steri, and come back and deal with your contaminating unit.
Okay.
Okay? Questions?